Good morning, members. It's the appointed time. We also have a quorum. I call the meeting to order. In the 2025 legislative year, as at the last meeting, we have approved 23 items with a total amount of $91.727 billion. There are two items for discussions on today's agenda. They are new funding applications. The amount involved is $3.9195 billion. If all items are approved, then the total number of items approved stands at 25 with a total allocation of $95.6429 billion, excluding the $27.34 billion for land acquisition and computerization projects. The total allocation for works is $68.322 billion. Let me remind members that if there is any direct or indirect pecuniary interest with any of the discussion items today, members, please refer to the requirements under Rule 83A of the Rules of Procedure. Disclose the nature of the interest before you speak. Members, please also pay attention to Rule 84 in relation to requirements on voting on items with a direct pecuniary interest. Item 1 is the construction of a clinical training amenities center at Sassoon. Number 6 is Sassoon Road, University of Hong Kong. Paper number PWSC 13. This is a proposal to upgrade 69 EG to Cat A at an estimated cost of $1.0249 billion in money of the day prices. On the 14th of March this year, the administration consulted the panel on health services. Members in general supported the forwarding of the item for discussion by this subcommittee. Key points of discussion of the panel has been emailed to members on the 27th of June. We have government representatives with us today. The attendance list has already been given to members. I'm going to dispense with the introduction. Members, if you would like to ask questions, please press the request to speak button. Before members ask questions, the administration would like to take us through the paper. We'll first hear from Ms. Elaine Mack, Deputy Secretary. Thank you. I thank the Chairman for the opportunity to supplement information in relation to paragraph 14. Indeed, on the 14th of March, we have consulted the Health Services Panel. Members in general supported the project as well as the discussion by this subcommittee. Members in a meeting said that the Hong Kong U should consult residents nearby, especially those that live in low-rise residential buildings along Bisney Road. The Hong Kong U has consulted the South District Council as well as residents in the nearby area. You will find information in paragraph 15. If necessary, we'll ask the Hong Kong U to supplement further information. Thank you. I'll read out the names of members who would like to ask questions. We have Mr. Lam Chun Sing, Mr. Chen Siu Hong, Mr. Xiang Hai Long, Mr. Lo Wai Kwok, Mr. Chen Hock Fong, Mr. Lee Chen Kang, and Dr. Hui Lee. We'll first hear from Mr. Lam Chun Sing. 4 minutes question and answers included. This is in relation to a clinical training amenities center. We've heard about a spate of medical incidents, say for example, misconnection of the tube. Well, there was a review conducted on public healthcare services. It was mentioned that perhaps there is insufficient clinical experience of those who joined the profession recently. I understand that the report was in relation to the hospital authority, but I'd like to ask, a university is a training institute. Perhaps at an early stage there can be further training to give practitioners better clinical experience, say for example, to enhance their understanding of patient safety. Can we make use of facilities or hardware to improve that? I'm also concerned about the overall expansion of the Faculty of Medicine of the Hong Kong U. I understand that the plan covers short, medium, and long term. In the long term, everything will be completed by 2031. However, this is only the item under discussion is phase 1 of the medium-term project. It will take 4 years to complete. If there is any delay, will it affect the long-term development schedule? Because there are also number of projects at number 7 and 21 of Sassoon Road. Will any delay prolong the entire project by another decade? If there is any delay, will it have an impact on the development of the Faculty of Medicine of the Hong Kong U? We are going to have a 3rd medical school in Hong Kong. There will be competition. If there is any delay, will it have a negative impact on the edge of the Hong Kong U or on training of the medical professions? Perhaps in relation to the overall plan of the Hong Kong U as well as patient safety, I will defer to the Hong Kong U. I'll first reply to the second part of the member's question. That is in relation to our plan over short, medium, and long term. We've already completed the short-term projects. This is a project in the medium term. It's in relation to clinical training facilities as well as dormitories. You may remember that to the east of Sassoon Road, there is a project which is a medium-term project. That project is still under discussion. That is because of the South Island line as well as town planning. Once it's ready, we'll come to you for funding approval. Number 7, Sassoon Road. If we get the approval of this item today, we hope that we will be able to come here within 6 months' time for the TFS funding application. In relation to the other part of the question, I will defer to Professor Cheung. The new facility and the accommodation facilities will ensure quality of our students. We currently have 300 places in our dormitory. With the project, it will be increased to 700 places. Well, it was over 3 decades ago when we have the Faculty of Medicine. Back then, the intake was only 150. We are going to have 325 intake every year. The accommodation will be for senior year students because we would like them to cover more different types of cases so that they can build up experience. They live in accommodation, and if they are called to handle cases in the evening or at night, they will be involved as well. That's why it's very close to the Queen Mary Hospital. There are also clinical training facilities there. I talked about giving them practice. In the new project, there will be dummies and facilities for students to practice, say, for example, suture. I think it will enhance the quality and skills of our future doctors. That includes patient safety. Mr. Chen Siu-hong, thank you. Well, this is a funding approval for $1.0249 billion to build a clinical training amenities center. Is it expensive? Well, I see some information about comparable projects. I understand that there is a certain uniqueness in this project. The cost is comparable to other projects. Compared to when we had a discussion in the panel, now the cost is reduced by about $2 billion. $20 million. I think that there is room for further reduction. Well, the site itself is unique. There may be site constraints, but it's not mentioned in the paper. In paragraph 12, well, there are certain estimates in terms of money of the day. The Hong Kong U intends to afford the contract on a lump sum basis because it provides a clear definition of the scope of the works in advance. The Development Bureau advocates the use of a new contract because there is a risk sharing. I don't think you will use this new approach. Are there any special reasons that that new approach is abandoned in this item? How do you decide when to use it? I see that in terms of the scope, I heard from the previous meeting that residents were concerned about noise and nuisance during the construction period. The site itself is very close to residential area. If you just talked about mitigation measures of new methods of construction and also noise barrier measures to keep the dust to a minimum, well, are there any other measures in place? I will defer to the Hong Kong U Director of Estates Office, Mr. Sunny Yeung. Thank you, ma'am. Thank you. My name is Sunny. I would like to talk about the new engineering contract, NEC. Well, it's about the timing when tender documents as well as the information was compiled. It was back in 2022. At that time, Hong Kong U was not ready yet, and we did not have sufficient understanding of the new engineering contract. We now have several senior members of the estate office that have received NEC trainings, and there was also, in addition, a one-day seminar with government officials. I have followed up on this. I'm also the first batch of adjudicator of NEC. I'm also an NEC engineer too. We will adopt NEC now, and we take the initiative to use this type of contract in new projects. Why is it not used in this project? Even back in 2022, we understand that the plan was being conceived, but during then, you still have to wait for the price to be returned. There was time to use NEC. So why wasn't it used in this project? Well, let me continue to answer members' question. When we prepared tender documents, it was not just about choosing a type of document. The entire procurement procedure, terms of contracts, will have to be considered. We have different conditions of the contract. They were all ready back in 2022. The tender exercise was smooth. It was just the timing. NEC was not considered back then because of timing. In addition, our team did not have sufficient understanding of the operation of the NEC. So it's down to the timing and our inadequate understanding of this approach.
Now about the mitigation measures to minimize the nuisance cost to nearby residents. I'll defer to Mr. Chu. Now on the cost, we have compared this project with the project of CUHK. There will be a student center at the podium and there will be simulation wards. Can you focus on noises that will be generated? We adopt the MIC model. In 2023, in the Wong Chok Han student hostel project, we adopted the same method. And next to it, we had the Singaporean International School. If we adopt MIC, we will have much lower dust emission as well as noise pollution. In 2023, we talked to the school principal of the international school, and we did not have any noise problems. This is because most of the works were completed in the factory, and the components were sent to the site for assembly, so it greatly reduced dust emission. Also, we adopted drilling method. And after the drilling, the piles will be installed in the foundation, and that also helped reduce dust emission as well. Chairman, I asked about why Hong Kong U did not adopt NEC and did not quite understand the reply. Well, you may ask follow-up questions afterwards. Well, the principal assistant, the permanent secretary is here. Will the administration tell us more about this, because they are well aware of the relevant guidelines? Can the permanent secretary supplement? Because, well, you have already overrun Mr. Chen. I understand that you are not happy with the answer. You may choose how to follow up yourself with the administration. Permanent secretary. Well, let me supplement. We have adopted NEC for some 16 years within the government, and we prioritize using NEC for each project. For other public organizations, they have a traditional way of dealing with things. And in the past few years, public organizations have been quite happy to use NEC, like Hong Kong U said. They are open-minded about this, and we will continue to talk to them about this. Mr. Chang Hailong, I speak in support of this project to build a clinical training amenity center. I have 3 questions. I want to follow up on what Mr. Chen Xiuhong said. Since 2022, well, according to Hong Kong U, it did not have time to implement NEC, but I don't think this is reasonable because this has been implemented by the Development Bureau since 2009. This helps reduce cost, and so I think we should follow the direction of the Development Bureau for all the projects implemented after 2022. You said that you are holding tendering exercise in parallel, so I think it is only reasonable that you adopt NEC. I've read the paper, and I know that you will demolish the Madam S.H. Ho residence as well as the associated canteen. I'm aware that there will be foundation works and some $93 million of contingency are reserved. Well, a lot of times we reserve 10% for contingencies, but I don't see the need to do so in this project. It is a simple project. How come you need to reserve so much money for contingencies? What kind of contingencies do you foresee? Now, the Madam S.H. Ho residence will be demolished, and will the 700 bed spaces, I mean the new student residence, will be named as the Madam S.H. Ho residence as well? I'll defer to Mr. Chu. Now, on the 10% contingency fees, I will give a response. There will be uncertainties during the construction. We are going to use the MIC method, and it will ensure a certain level of stability. However, there is a slope. We have carried out site investigation, but we have to take into consideration risks. So we are reserving 10% for contingencies. We will return the money to the government if it is not used. The university will definitely try its best to save money and return the remaining money to the government. Yes. Mr. Sunny Yeung. I am Chen Yingxing from Hong Kong U. Just now, the member asked about the naming of the student residence. Afterwards, I'll invite Mr. Sunny Yeung to talk about NEC. Now, about the redevelopment. Dr. Ho, the person in charge of the fund, we keep in close communication with him. And he has been talking to the senior year medical students. We also recently have held a high table, and Dr. Ho was there as well. If we get the funding, we plan to, in early September, hold a last night event, and we've already invited Dr. Ho to attend the event. And we have been in close communication with Dr. Ho, and the S.H. Ho Fund supports the naming arrangement of the new student residence. Will Mr. Sunny Yeung talk about why you do not adopt NEC? We did not rule out the option of adopting NEC. Now, going back to the material time, we were preparing the tender documents, and we adopted an approach that Hong Kong U was most familiar with and most confident in. And we have been adopting the traditional contract for a long time. And back then, we did not think about using NEC. we were not well prepared enough to use NEC because we had little understanding of NEC, so we could only opt for a method that was the safest and favorable to the construction project. We've heard what the member said. In future, we will prioritize NEC, and we have sent our staff for training, and this is the major purpose why we sent them for training. Well, Mr. Sham mentioned that NEC has been adopted by the government since 2009. So members had questions about why you did not use NEC in 2022. And are you familiar with NEC now, and when will the staff from Hong Kong U who are in charge of engineering works be familiar with NEC? Mr. Cheung. Of the first batch of 4 staff members have already completed the training on NEC, and the second batch has started the training as well. I myself has also received relevant training. We'll ensure that within Hong Kong U we will build a culture to use NEC. We will do better. The first batch has already received the training as mentioned. I think members raised this question mainly because we want to move with times. Like in this project, you are adopting MIC. So I hope you will keep abreast of the times and adopt NEC. So you should have thought about using NEC in 2022. This is a good model, and this would help reduce construction cost. I think Hong Kong U should do better in this regard. Mr. Cheung, I agree with the chairman. Project proponents have been adopting the conventional method because they're most familiar with it. I think there should be more options in future. The Development Bureau has implemented NEC for years, but it looks like the Development Bureau can better enhance its procurement model. For example, it can adopt central procurement, and it can promote this method to the entire city. Dr. Lo Wai Kwok, we've had a chronic shortage of healthcare staff in Hong Kong. Hong Kong U has contributed a lot. Now it has plans to expand its healthcare related facility, so I support this project. I've read the paper. There are some drawings in it. Well, I admire Hong Kong U because it is willing to embrace challenges. It's going to demolish some old buildings and build a new center. Well, I see that there is some connection between the old and new buildings. Please explain afterwards. Well, some existing student residences will be preserved. This is not just about managing noise and the construction works. Even if you adopt MIC, there will be certain level of difficulties. So how will you deal with the challenges? Also, are there no other options? Do you have to use this challenging way to build the center? Well, this electrical complex is also a very complicated project, and it was completed successfully. So I'm well aware that this kind of construction works can exert huge burden and pressure to different parties, including contractors. So why do you opt for this difficult construction method? Under Secretary, I'll say a few words first. On site selection, this is a facility for medical students, so it has to be close to the Queen Mary Hospital. If they cannot access the hospital, they will not be able to receive the training. So we've been thinking hard, and we think that this is a method that we can implement. On the details, I will defer to Professor Chu.
我有幾方面可以解釋嘅。
In relation to the challenges of the construction, in relation to, say, student residents, I can elaborate. We have sufficient experience in this regard. There is one project and a couple more that when we have to work in a site where there are existing structures. This site is smaller than what we have dealt with before. We have already gone through very detailed investigation. There are also professors from the university conducting studies on the different aspects of the construction, say for example hoisting, how to avoid a collision with other structures during the hoisting procedure. We hope we will put in place safety measures. We're also working with an expert on an MIC transport platform to be used. In terms of safety to passers-by, we have already included relevant plans. We have in place what it takes to ensure safety in the construction of the project. Mr. Low, I support this project. Mr. Chan Hock Fong. We asked questions in the panel meeting about consultation. The Hong Kong U has since then consulted the District Council, which is a very good move. I understand there will be nuisance created during the construction period. Will you set up a working group to collect complaints from residents so that response can be taken as soon as possible? You talked about using technology to reduce noise. I think that the noisiest part is the drill pile as well as demolition. Maybe you do not use hydraulic devices. Use some other quieter devices in a demolition process. What do you think the difference is if you use different devices? I have seen another project of yours. The MIC was used and it was indeed rather good. Will you adopt a similar approach in terms of MIC in this project? There will be more people living in this site after the new facilities are commissioned. Well, people will have to live there and they eat there. It's easy for them to go to the Queen Mary Hospital because there is a footbridge. But what about meals? They may have to go to the Western District, Kennedy Town, to eat. That area is rather congested. So what do you propose to address this issue? That is in relation to students commuting. Well, we have received information from the consultation. I will defer to Professor Chu in relation to these areas. In terms of consultation with the public, as we've done with before, we will keep in contact with district councillors. For the Guangzhou Hang and the High West site development, we have been liaising with district councillors. We will monitor views and comments from residents. We're glad that we have not received any complaints in the Guangzhou Hang project. In relation to the High West site development, once we received complaints, we immediately dealt with it. Just like what we've done before, we will liaise well with district councillors. In terms of noise, we will use hydraulic devices, and we will try to reduce noise as possible. We are aware that students are living nearby, so we will schedule our works to avoid examination periods. In terms of MIC, the same approach will be used just like High West and Guangzhou Hang. Furniture will be manufactured in the plant. For meals, you can see that there is a canteen in the project. We will reprovision the canteen, so students only have to go downstairs to eat. We've also added a few mobile catering outlets. That's all I would like to say. Next, Mr. Lee Cheung. Well, I'm first of all concerned about noise. The site is rather close to dormitories as well as residential areas. Can you give me some data in relation to the noise during construction? MIC, I understand that it is commonly used. In addition, is cost saving. However, the parts are sizable. There is a roundabout or Pok Fu Lam. Ambulances use this roundabout to go to Queen Mary Hospital. Will there be construction as a result? Because you have to transport materials to the site. Sometimes there may be queues to go into the site, causing congestion. How do you address this problem? I see that there are 700 places in the accommodation facilities. Will you charge students? How much? If the fees are too high, it may add to the burden of students. There will only be a 10% increase in terms of training places from 295 to about 325. Will the project further increase training places? That means in the future more doctors will be trained. Well, I see from the plan that toilets are at either end of the site. That means students will have to go to one end of the site to get changed or to have a shower. I'll first answer in relation to manpower. About MIC, design of the toilet, as well as noise, I'll defer to Professor Chen. Fees of the dormitories, I will defer to Professor Chu. We do want to increase training places. That's why we're working hard on a third medical school. If possible, we will increase the number of training places for the existing 2 medical schools. noise. We will have ways to address the noise issues. We will install noise monitors. The area where is closest to residential areas is Business Road. There is a great difference of about 30 meters. That is 60 to 70 meters. We will monitor noise. We have conducted a site visit at Business Road to take a measurement. It's still far away from our site, and there are also trees in between. We will monitor noise, but the monitoring will not be continuous. However, we will take continuous noise measurement from the dormitory. In relation to the roundabout and ambulances, well, in our previous projects, that is, there are about 925 modules at Wang Chuk Hang. At High West, about 1,250. We do not store these modules at the entrance of the site. We will avoid peak hours in traffic to install or assemble these modules in order to reduce the burden on traffic. Toilets have shower facilities inside. That's why we put them at either end of the corridor to shorten the distance of the students having to walk a long way just to go to the toilet or use the showers. Mr. Chan, in relation to fees, the current SHO residents are single rooms. We charge $78. There may be an adjustment of the fees in the future. 78 every month? Every day. Or every month, every day. So about 3,000, 2,000, 3,000 a month. Next, Dr. Ho Yi Lee. I'm a board member of, I'm the council member of the Hong Kong U. Well, there is an urgent need, I agree with that. But I'd like to get more information. First, are there special requirements for this site? I see that there are training facilities as well as accommodation facilities. Well, have you incorporated all the different requirements in the project? I see that there are different projects in the short, medium, and long term. There is not much space near Sassoon Road. Is it possible to earmark site with a bigger space for further development in the future? Or have you taken into account the long-term needs of additional facilities in future projects? I will defer to Professor Cheung in relation to the training facilities. What I can say is that there is a long-term plan for development, not just number 6. It also includes number 7 and 27. I will now defer to Professor Cheung. We have earmarked a space to be used as classrooms or activity rooms, and they can undergo training of different kinds there. As I said, there may be rooms with dummies for students to learn how to resuscitate patients. The current facilities do not have sufficient space. Some students, when they're learning suture, they will have to work on pig skin in the pantry. With bigger space available, training facilities will improve too. Before students actually meet patients, they may have to conduct a certain kind of physical checks, and there will be facilities to do that as well.
一步嘅訓練。
Well, you mentioned about the training facilities, and you said that equipment will be installed. Well, say for example labs. You'll have to take into account the weight as well as the building height or headroom. So I just want to confirm that there are no special requirements on the building itself in order to build these facilities. Undersecretary, Dr. Lee's understanding is correct. There won't be labs, it's just that there will be clinical training facilities placed inside the center. Mr. Holden Chow, I support this project. This is conducive to future training of medical students. I'd like to ask about enclosure 2. Let's look at the drawing together. I see that the purplish blue area will be classrooms. So on the left-hand side, there will be classrooms and clinical training facilities. The pink area, it's mostly a consultation room as well as meeting rooms. I don't know if I understand this correctly. The clinical training facilities will be very crucial for students. Of course, meeting rooms will be important too. I wonder if the administration has thought about reserving more spaces for clinical training, and there could be fewer meeting rooms. Now, I see that meeting rooms will account half of the space here, and another half will be clinical training facilities. I think clinical training facilities are the most important. All the classes as well as practical training will be held there. I think this could be made flexible for meeting rooms. I wonder if it is better to reserve more spaces for clinical training facilities. I'm not sure what's the rationale behind your arrangement. Undersecretary, I thank Mr. Holden Chow for caring for our students. These meeting rooms will be helpful for training as well. I'll ask Professor Cheung to explain. Professor Cheung, there will be about 10 clinical psychologists as well as counselors who will offer support to our students. So this building will not only serve medical students but other personnel as well. The meeting rooms are for the counselors as well as the psychologists if they need to meet with the students. There will be noise insulation for this room, and they can facilitate one-on-one consultation between psychologists and students. So they aren't normal or ordinary meeting rooms, they are special meeting rooms. Next, Mr. Benson Look. We have had a high demand for doctors in Hong Kong. And Hong Kong U has contributed a lot in training up doctors. This facility will be close to the Queen Mary Hospital. I think this is an appropriate location. Well, over the past 20 years, according to the paper, There's only been a 54% increase in terms of teaching facility, but we have had an increase of 200% in terms of the number of medical students. This is a huge increase. This project will cost $1.024 billion. How many more medical students will be able to receive training in this new facility? Have you made an estimate? Secondly, about fundraising. According to enclosure 8 of the paper, there are a lot of self-financed items. Well, have you thought about other financing options apart from asking the Hong Kong U to pay out of its own pocket? Now, furniture and equipment will cost about $80 million. Does that include teaching facilities for medical students? Lastly, about consultation. I think the administration has done quite enough on consultation. Earlier, we've got views that there wasn't enough consultation, but I see from the paper that the administration as well as Hong Kong U has consulted the relevant panel and the Southern District Council. According to Hong Kong U, if it receives any complaints, it will deal with them immediately. Well, this is great, but I also hope the university will notify nearby residents on any potential impacts in a timely manner to avoid any complaints. I hope that there will be regular communication between Hong Kong U and the district councillors as well as the nearby residents. Undersecretary, I'll first deal with the question about students, and on the question about furniture and equipment, I will defer to Dr. Chu. Now, under the development plan, there are short, medium, and long-term plans. This is a medium-term plan. We hope that every year Hong Kong U can admit 400 medical students, and we are quite far from that target now. Dr. Chu, on financing this project, Hong Kong U has already spent $780 million. We will need about $120 million for our business school and the relevant construction works. We also need subsidies for the school hostels, and that's about $12 billion that we need. So we've already tried our best to finance these projects. For the $80 million, apart from furniture, we'll need hospital beds as well as other healthcare related facilities. Next, Mr. Chu Kwok-keung, Chairman. One of the reasons to build this clinical training amenities center is because we have had 30 medical students more every year. And is it necessary to spend $1 billion more for the additional 30 students every year? Well, I understand there are reasons behind this project, but will the administration have to pay for all the money to build the residence? I don't know how much the accommodation facility will account for in this project. Will the administration consider adopting a public-private partnership model, or will it rely on the private sector to build this project? Well, a lot of funding has been slashed for primary and secondary schools in Hong Kong. Schools have not had enough money to hire people. Should the government save up more money? Will the government consider coming up with a licensing regime or adopting a public-private partnership model? Will it formulate a licensing regime or registration mechanism in the long run. So this is just a comment from me. My major question is, how much will the accommodation facility account for in this project? I'll ask Dr. Chu to reply. Dr. Chu, 70% of the area is for hostel and 30% is for teaching as well as healthcare related facilities. On the questions about funding, I think this is a policy matter. Perhaps we can have Dr. Chu express his views on other occasions. Next, Dr. Louis Long. This is a $1 billion project at number 6 Sassoon Road. I support this project not because I am an alumnus of this university. It's because I have read the justifications and the figures in the paper, and I think this project deserves our support. Some members mentioned about the construction cost. I looked at enclosure 7 of the paper. So it's about $20,000 per square meter. And the building services, as well as the construction work itself, is not too costly. I have a question about the design. I looked at the drawings. On the first page of enclosure 1 is the site plan of the existing student residence. I noticed that you will demolish the existing student residence, and you mentioned that you have consulted the district council. So it is the students who are living in the existing student residence that will be affected the most. Have you consulted those students? I believe they are medical students. Every time I pass by, I notice that during exams, there are banners hung near the residence. So I want to know if you have consulted the students. Also, it looks like no parking spaces will be provided under this project. I know that you are not allowing students to park their cars, but since there will be clinical training, professors may drive to the facility, so will there be parking spaces for them? Now I'm looking at page 3 of enclosure 2. If you look at the floor plan for the first floor, there will be about 30 student rooms. Same for the other floors. If you look at page 5 of enclosure 2 on the 15th floor, there will be 8 larger rooms. I believe they are single rooms on typical floors. Are the 8 larger rooms for students' use as well? How come they are bigger? Undersecretary, I thank Mr. Louis Long for the support. I also hope medical students will continue to cheer for each other during exam. I'll defer to Dr. Chu about parking spaces. We've already talked to the students. They know that spaces are tight, and with existing resources it's hard to build a facility like this. They have shown their understanding. We will step up our support. We will use hydraulic shears instead of pneumatic drill. Now on parking spaces, we will have 11 parking spaces for senior tutors. There will be no other parking spaces. Now you mentioned that On each typical floor, there will be 30 rooms. They are mostly single rooms. And on the 15th floor, there will be larger rooms. They are twin bedrooms. Well, we are incorporating different design elements. The double rooms are mostly on the top floors. Mr. Stanley Ng. We have to expand the room for training for students.
你似乎又好似遠水救不了近火。
But it seems that it will take a very long time for the facilities to be completed to meet demand. Can we hear from the administration or the Hong Kong U? Is this the best approach? Shouldn't clinical training facilities be at actual hospitals instead of doing it separately? It takes time for these facilities to be completed, so there is a lag. Mr. Ng is right. For students to learn skills, the best place is at the hospital. That's why dormitories are close to the teaching hospital. For the Chinese University, it's the Prince of Wales Hospital, and for Hong Kong U, it's Queen Mary Hospital, because it is very important for dormitories to be close to teaching hospitals. They don't work just from 9 to 5. They have to work in the evenings as well. That's why the dormitories are different from other faculties. For the other faculties, dormitories are for students to just live there, but when it comes to medical school, dormitories are for students to stay in between the time when they are working at hospitals. That's why we want senior year students to stay at dormitories so that they can have easy access to classes at hospitals. Mr. Ng also talks about demolishing existing buildings. He asks whether it's the best way. Of course, we would like to start from scratch with a vacant site. Hospital, the Queen Mary Hospital is in the Southern District. Sassoon Road is a long strip of road, so there are limitations. The Hong Kong U has been working on identifying suitable sites to increase training facilities and dormitories in the most effective way. Mr. Chen Pui Leung, I support the project itself, but I have some questions in relation to the project cost. It says here that it is about $25,000 per square meters. Compared to the Chinese University project, is more expensive by about 3,000 per square meters. I think the part where it's most expensive is the dormitory, because there are single rooms. It's about $2,500, $2,200 per square meters more expensive. In total, it would be about $40 million. I see that they're just rooms, not ensuite. 700 places. We're talking about over $100,000 per wall. If we use MIC, the cost should be lower. Can you give me further explanation about how come the cost is so high? I'll defer to Dr. Chu. Let me explain. It's not about the wall. Well, we use a hotel design, so each wall is fire resistant. In addition, we have to double the amount of fire insulation fire services installations, say for example smoke alarm, sprinkler, we have double the amount of sprinklers as well as air conditioners. All that have to be taken into account when it comes to loading and the requirements of the foundation. So it's not just by the individual accounts, it's the total amount. Any further questions? If there are no further questions, I now put this item to vote. Members, those who are in favor of PWSC 2025-26 number 13, please raise your hands. Those who are against, please raise your hands. I think the question is agreed by majority of members who have voted. The item is endorsed. In relation to whether the Financial Committee should have a further discussion on this item, in accordance with Rule 41A of the procedure of the PWSC, I put the following question to vote. The Public Works Subcommittee recommends further discussion of the proposal in the PWSC 2025-26 number 13 by the Finance Committee. Let me remind members, if this question is passed, that means the subcommittee recommends further discussion of this item by the Finance Committee. If the question is vetoed, that means the subcommittee does not recommend further discussion of this item by the Finance Committee. Those in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by majority of members who have voted. This question is vetoed. That means the subcommittee does not recommend further discussion by the Finance Committee in relation to PWSC 2025-26 number 13. That's the end of this item. I thank government representatives for attending. We now move on to the second item. We'll invite the administration to come in. I'll defer to the Deputy Chair, Mr. Ben Chen, to chair the meeting.
Hello. 好，官員坐。
Government representatives are seated. This is an item that recommends the upgrading of 200 GK to Cat A at an estimated cost of $2.891 billion in money of the day prices. On the 27th of May, the administration consulted the development panel. Members did not oppose to forwarding this item for the consideration by this subcommittee. Key areas of deliberation of the panel has been sent to members. It was on the email dated the 27th of June. Members, I'll now read out your names. Mr. Leung Man Kwok, Mr. Vincent Cheung, Mr. Kit Sun Young, Mr. Andrew Lam, Mr. Nam Chun Sing, Mr. Leung Man Kwok, and Mr. Chen Siu Hong. 4 minutes question and answers included. We'll start with Mr. Leung Man Kwok. So in relation to this joint user complex at Cheung Sha Wan Road, there are a number of facilities, recreational sports centers, district health center, community health center, reprovisioning of government offices, welfare facilities including elderly services, support services for mentally handicapped persons, and PWDs. I support all these the construction of all these facilities. While I oppose to this hostel for single persons. There was a discussion in the development panel. The reply from the administration was that the existing facilities at Heiwa House are for those under the age of 60. It's under the purview of the district offices. This one is run by the SWD, providing support for those above the age of 60. They are for single persons. I'd like to ask, how much space is left at Heiwa House? The proposed item have only about 40 places. How come that, if there is available space at Heiwa House, why do you have to have additional ones and separate the groups by the age of 60? Perhaps it can be incorporated at Heiwa House. It's just the different facilities are run by different departments. Why do you have to have a brand new facility at the new facility? I would like to get more information in relation to the availability of services at Heiwa House. Why do you have to separate the users by the age of 60? There is a greater need for support centers for ethnic minorities. There is also an acute need for services for the elderly, for those that are mentally handicapped, or for PWDs. Previously, there were demands to reprovision age facilities. There are certain facilities, say for example the Lee Chang-ok swimming pool, that's over 50 years old. Are there plans to reprovision or redevelop these old facilities? Well, there's a need to redevelop old facilities, say for example those that are over the age of 50. I'll now defer to the Deputy Secretary. I'll first answer the second part of the question. In relation to the hostel for single persons, I will defer to the SWD. We proposed a joint user complex at this location because we saw an opportunity. The URA has some redevelopment plans in nearby areas. There is a site within which there is a Cheung Sports Center, which is quite old, over 50 years. We would like to make use of the funding application to reprovide the facilities. We want to make sure that the sports facilities will be most updated. I'm not going to make a comparison here. Our stance is that we continuously look for suitable sites, opportunities to upgrade existing old facilities. This is one of those opportunities. This is not just about reprovisioning and upgrading of recreational and sports facilities. It's also an opportunity for us to provide healthcare as well as welfare facilities. The government has thoroughly considered different factors. I'll now defer to the SWD in relation to the hostel for single persons. I thank the member for the question. Let me give you more information about Heiwa House. The Home Affairs Department uses Heiwa House to receive those who have been affected by the beds and accommodation legislation. NGOs subvented by SWD runs hostels for single persons. The target groups are street sleepers, those who have health problems. They can take care of themselves. We provide counseling services as well as advisory service to help them find long-term accommodation, so the target groups are different. In the joint complex, we provide double rooms to users. In addition, we provide them with advisory services as well as counseling service to help them find long-term accommodation. As at the end of May 2025, there are about 773 people who are over the age of 60. About 20% of them live in Sham, Shui. From an audit report, sorry, let me interrupt. I think we get the information from the development panel meeting minutes. How come the services cannot be provided at Heiwa House? You can still provide these services at Heiwa House. Well, is there available facilities at Heiwa House? I don't have the actual number in Heiwa House. My understanding is that there are about 30% of these places that are vacant. They only provide accommodation. Well, when it comes to our facilities, we provide about 6 months term and counseling support services to help them find long-term accommodation. There was a question on whether the space can be used for other facilities, say for example childcare services or PW facilities. Well, majority of our facilities are under a level of 24 meters. However, when it comes to this, a single person hostel is above 24 meters.
Mr. Vincent Cheung. I support this project, but I agree with Mr. Scott Learn. I'm not sure why Heiwa House is not used, because 30% of the hostel places are retained. Well, you may think that there aren't enough urban hostel places for single persons, but you can make improvement. There are other welfare facilities in need, but you're not including them in this new complex. The district council is of the view that the ethnic minorities need help and support, but we're not giving enough importance to them. Now I have this question. I am looking at the floor plans and I understand that there will be a few lifts. I want to confirm whether each lift has its purpose. For example, they will be used by the LCSD, the SWD, as well as the FSD. Now on the floors, on the 14th, 15th and 16th floor, there will be a sports center. Well, how many spectator stands will there be? I believe that many schools will want to make use of the facilities to hold activities and competitions. Will there be mobile spectator stands? Also, as mentioned last time, on Lai Chi Kok Road, well, I understand that the URA has plans to consolidate the facilities there. Will there be basketball courts as well as other facilities there? Mr. Poon, 3 questions. Mr. Vincent Cheung mentioned about services for ethnic minorities. We understand there is the need for such services. Within this new complex, there are currently no facilities specifically for ethnic minorities, but still they can enjoy the services and facilities to be provided there. The government is going to consolidate the facilities in Sham Shui Po district, and some spaces will be vacated. It will be some years later, but I believe there will be more room for the administration to increase facilities for the ethnic minorities. We will also pass on Mr. Chang's comments to the relevant departments. Now, on the questions about lifts, There will be recreational, healthcare, as well as sports facilities. And for each set of these facilities, there will be a lift dedicated to them. And there will be different opening hours for the lifts. On the sports center, how many seats will there be? There will be 400 seats. And this meets the latest standards imposed by the LCSD. Under the latest standards, there needs to be 2 basketball courts. That means 4 basketball teams can take part in competitions at the same time in the facilities. Apart from basketball teams, some schools may rent the facilities for use. There will be foldable seats in the facility. Lastly, on the entrance exit on Lai Chi Kok Road, you can see from the paper that there will be site A and site B. We want to make good use of the sites. We, on one hand, want to reserve the open public spaces for the community. On the other hand, we want to make optimal use of the sites to build this new complex, to provide the relevant services and facilities. Yes, URA. I thank Mr. Cheung for the questions. Just now, Mr. Cheung asked whether the facilities on Lai Chi Kok Road will be built at the same time. We do not want to affect the parking spaces as well as the existing park on the road. How about the facilities near the courts? Will they be redeveloped too? Well, this is not within the project. But what you mentioned will be covered in phase 2 of the works. We will upgrade the park as well as the sports facilities. There will be 2 entrances and exits for the 3 sets of lifts, right? I know that there will be a lift lobby for the LCSD, and there will be other lift lobbies. Does that mean the hospital authority and the other departments will share the lift lobbies? Well, there will be 2 lift lobbies. SWD and the hospital authority will share 1 lift lobby, and for LCSD, on the ground floor as well as on the first floor, there will be lift lobbies. Mr. Kitson Young. I support this joint user complex project. I'd like to express my views. First, on the main sports facility, I see that there will be multi-purpose facilities that can be used as football courts, basketball courts, as well as badminton courts. We think that there's a need for fencing facilities in Hong Kong. Well, the administration has been looking for spaces to build fencing facilities. It's thinking of making use of the To Kwa Wan Sports Center. Well, if you're going to build this facility, and it is a multi-purpose facility, will you turn this into a fencing training facility? Where necessary, it can be used for fencing, so that relevant athletes don't have to look for spaces all the time. This is my first comment. Secondly, I agree with Mr. Scott Learn. I have reservations about how we make use of public money. According to the administration, 30% of Sunrise House is vacant. If you have 30% of vacancy in Sunrise House, will you have to still build this urban hostels for single persons? Because Sunrise House is underutilized. You can perhaps convert part of Sunrise House as a hostel for elderly people. Then you won't have to spend extra resources to serve those who need to stay in the urban hostel for single persons. That way you can provide more comprehensive support at Sunrise House. You may think about whether you want to expand Sunrise House instead. In Sham, we lack dental clinics. You will have district health centers as well as other healthcare facilities. If you have dental clinics there, it will make the services more complete. I think the government should think about this. Mr. Poon. Now, on the question about fencing facilities, I'll defer to the LCSD. On the situation with the Sunrise House, I believe the SWD has heard the views. I'll invite the SWD to follow up with the Home Affairs Department. On the point about dental clinics, I'll ask the Health Bureau to supplement. LCSD, please. Ms. Feng. We are proactively looking for an appropriate space to provide fencing training as well as competitions. We are looking for a large-scale venue for this. We are not trying to loot the To Kwa Wan Sports Center. It's just that we want to upgrade the relevant facilities, and they will be open for public use as soon as possible. Now, this sports center, we will have 2 basketball courts. We hope that in Cheung Wan and Sham we'll be able to provide appropriate facilities. On fencing, we have been identifying sites. As mentioned, we want to adopt a single-site, multiple-use approach. Chairman, the administration is now planning or making plans for this joint user complex. If you can introduce fencing facilities there, then there could be an additional site for fencing athletes. Well, please take note of the comment. Mr. Cheung, about Sunrise House, will you think about upgrading Sunrise House? This is under the purview of the Home Affairs Department, so I cannot answer for them. What I can say is that the urban hostel for single persons will provide services for those aged 60 or above and those with illnesses who need short-term accommodation services. Within the 6 months of accommodation services, we will provide counseling and guidance to the tenants. So this is not simply an accommodation facility. So we think that there is a need to have this hostel for single persons. Well, Mr. Kitson-Yang made a comment about having dental clinics. Well, you have rolled out some new policy. You are going to engage NGOs to provide dental services. Well, I believe you should engage NGOs to offer help. Mr. Andrew Lam. Thank you, Chairman. Going back to the paper about the construction cost, you mentioned about the Cheung complex as a reference. I'm not against this project, and I don't have any particular questions about the cost. I mainly want to talk about the Ma On Shan project. It's about $2 billion, and the Shui project is much smaller. If you want to make a comparison, the unit cost of the Ma On Shan project is cheaper than this one. So I hope that you can pick the right example to make a comparison. This is because we looked at the Ma On Shan project and the Shui project at the same time. Now, on LCSD facilities, as mentioned by the administration, the number of seats to be provided meets the standards imposed by the LCSD. I have a question about this. How did you come up with the standards? I said I wanted to use the Ma On Shan projects as an example. The sports facilities in Ma On Shan serve a similar function. There are 2 basketball courts and there are also multi-purpose facilities, and only 200 seats are provided there. For this particular project, you are going to have 400 seats. I also looked at the paper concerning the Ma On Shan project. It says that having taken into account the positioning of the facilities of LCSD as well as the topography and the relevant constraints, the seats were adjusted from 700 to 200 for the sports facilities there. If you look at the Ma On Shan project, it is about 7,000 square meters, and this particular project is 5,000 square meters. So how did you set the standards on the number of seats to be provided?
I'll defer to the LCSD. Ms. Fong, Assistant Director. Let me first give you more information about Ma On Shan. It's Area 103. Nearby there is Ma On Shan Sports Center. At the Ma On Shan Sports Center, there are 3 basketballs and 3,000 seating capacity. When it comes to positioning, we will consider different factors. Larger scale activities will go to Ma On Shan. The area is about 2 basketball courts. However, when it comes to the design as well as positioning, they are different. In Cheung, if it is high ceiling, there will be stores seating. When there are competitions, fellow students and parents can be seated there. When it comes to the main area, they are retractable seats of about 200 seats. If they are not used, they can be retracted to provide more space. So when it comes to design and use, the 2 different venues are different. You look at the positioning of the individual sports center. You don't look at the size and the number of basketball courts before you decide on the seating capacity. Well, if it can be changed from 200 to 300 to 700 or the other way around, there are actually no set indicators. It's just no set parameters. You just decide considering the site-specific factors. I guess different places will have a different construction cost. In this regard, I'll defer to the Architectural Services Department. Regarding the unit cost, we make a comparison with different joint user complexes, but each project is different. We choose from among the different projects one that is comparable for our comparison. Area 103, the joint user complex at Ma On Shan. For the Ma On Shan project, the facilities include the stadium, that is the sports center, the community hall, and public car parks. The construction unit cost of the car park is cheaper compared to other facilities. We choose area 4 and 30 of Cheung as the comparison because the schedule of accommodation is similar to this one. 40% of it are healthcare and facilities. In this one, we have a sports center and a community center. These are quite spacious. That's why we have chosen area 4 and 30 joint user complex as Cheung for our comparison. Mr. Lam Chun Sing. I understand that when it comes to social welfare projects, mostly are supported by the Lotteries Fund. The fund has a balance of about $20 billion, but most of it will be earmarked to pay for projects. There won't be sufficient fund, that's why it will be funded. This will be funded by the Public Works Fund. Construction cost under K, about $144 million on one item. It is difficult for us to gauge whether the renovation is cheaper or not in relation to cost reserved for fitting out works. The project is to be funded by the Public Works program, not Lotteries Fund. Will there be an impact on social welfare facilities? The government suffering from a financial deficit. If this project is not funded by the Lotteries Fund, will there be cuts in funding support for social welfare facilities in the future? I have another question about the car park. There are 60 parking spaces. Some are reserved for people who work there. So there will be only a handful of parking spaces reserved for visitors. You said that there is already a railway line there, so there can't be another basement. Perhaps you need to have a dynamic assessment. During holidays, people may drive there to use the recreational facilities. Is there any possibility of adding additional parking spaces? First question, social welfare facilities. I'll defer to the SWD to answer questions about funding. Mr. Yong. Yes. A public works of social welfare facilities used to be funded by the Lotteries Fund. For every year, there is about $2 billion, say 2024-25. So for different projects, it costs about $1.4 billion or $900 million. A lot goes out from the Lotteries Fund. In 24-25, there are about $3.5 billion spent on social welfare facilities. Unused balances stands at about $4 billion. In the long run, the Lotteries Fund cannot be used to fund all public works. So starting from 2024-25, social welfare facilities will be funded by Public Works program. So the source of funding will be more stable. It will be better for the construction of social welfare facilities. I hope that social welfare facilities will not be affected because of the financial deficit. I will answer in relation to parking spaces. That is an area of concern of ours as well. Members have given us very constructive input in the panel meeting. We have supplied an information paper to the panel. I'd like to highlight 4 points. With the LCSD and the URA, we work with them to consider making use of the nearby site to provide additional parking spaces for visitors. Parking spaces at the complex, including those for PWDs, are available. If need be, service users can liaise with the management to ask for the use of these parking spaces. We will consider various factors when it comes to the demand. The complex is very convenient near train stations and bus stops, and there are also nearby parking car parks. Perhaps during holidays, you will make available car parking spaces for offices to be used by visitors. Well, if the members have any questions to ask, please come down here. After Mr. Lowe has spoken, otherwise I'll draw a line. On the 27th of May, in the development panel meeting, a number of members have spoken on this project. They expressed concerns. They said that some people may drive elderly people or people with disabilities to use the facilities at the complex. For these people, that is not a luxury that is not luxury. For users that are PWDs or people with mental disabilities, it would be very difficult for them if they were asked to park in a nearby area and walk there. I see an information paper giving us further information. And I see that more thoughts have been put into this project and in the explanation after the meeting. It says that there are 3 parking spaces for PWDs. If necessary, contacts can be made with the management of the complex to use available spaces, other available spaces. I hope that this undertaking is taken seriously. I hope that other users at the complex will remember this undertaking, that they will release the parking spaces for those in need. It says that in the Sham Sports Center there is a public car park. The administration said that they will look into providing additional parking spaces. In a panel meeting, some members said that there is an open space adjoining this complex. And I think you can use the open space as car parking spaces as well. I hope that in the future, when it comes to the design of public facilities, you will give more consideration to loading, unloading, parking, and pick up and drop off points. Equipment may have to be transported to the venue. Vehicles will have to be parked before transporting the equipment there. Sometimes users find it difficult to make use of the venues even if they are given a chance because it's difficult to transport equipment there.
Mr. Poon, we have considered what Dr. Low said. We'll pay more attention to this. There will be loading and unloading areas. There will also be parking spaces for the disabled. I want to stress that even with space constraints, there will still be parking spaces for the disabled, and this is exactly because we have taken to the needs of potential users. Carers who bring, for example, the disabled to this new complex, for them there will be special management arrangement. And we hope the future operating organization as well as the management office will make good use of the parking spaces. I'm going to draw the line here, Mr. Chen Xiu-hong. This project will cost about $2.9 billion. At both the panel meeting as well as the discussion just now, most members expressed support for this project because this will benefit the local residents. This is going to be an important government facilities for them, so I in principle support this project. We are at the PWSC now, and we have to focus on the construction cost as well as issues in relation to planning, for example. Mr. Andrew Lam just now mentioned about similar projects, for example, the one in Ma On Shan. He made a comparison on the construction costs. I understand that there are reasons for us to compare these projects, and there is actually not a big difference in terms of the construction costs of these projects. Mr. Lam also asked about the standards of seat provision. I'm not going to repeat the questions here. I'd like to ask about the entrustment fee. Actually, this was discussed at the panel meeting. According to the administration last time, it's entrusting the URA to manage and supervise the project. It is going to pay the URA 12.5% on the entrustment, and design and build is adopted for this project, and because of the expenses on the design, and it ends up paying 9.6% to the URA, and that's about $207 million. What I care about is whether there will be a synergy created if we have the URA managing this project. But should we pay 12.5%? I understand that 12.5% have been used for projects managed by, for example, the Housing Authority as well. And this percentage has not been reviewed. Can we use a zero-based budgeting? There will be merits to have the URA managing the project because there will be management staff there and the synergy can be created. However, is there room to compress the cost if this project is handled by the Architectural Services Department, for example? It will be much costlier than $2 billion. Well, now we only have to spend about $2 billion, and therefore I support this project. Well, you're reducing the entrustment fee from 12.5% to 9.6%, but still will synergy be created, and is this value for money? Permanent Secretary. I thank Mr. Cheung for the questions. On different occasions, we've talked about the entrustment fee. At the previous meeting, I've talked about this. We, together with the FSTB, is reviewing the percentage. There are different ways to review the reasonableness of this percentage. We will draw reference from what Mr. Chan said. We want to ensure reasonableness in terms of the entrustment fee. At the same time, we also want to ensure synergy. We hope that within this year we'll be able to come up with some suggestions, and we will share them with members. Well, the Permanent Secretary has for a few times promised that there will be a review within this year. Well, we look forward to it, but will you report to the Finance Committee after talking to the URA? For example, is there room to further compress the construction cost to lower than $2 billion? You can make an estimate of how many people are needed from the URA to help manage and supervise this project. For example, the EMSD in other projects have reduced the cost by 20 to 30%. I wonder if the administration can report to the Finance Committee about whether there's room to further reduce the construction cost. Mr. Poon? Now, on the entrustment fee for the URA, we look at what the URA needs to do. For example, it has to hold tendering exercise. And according to the paper, you can see that there are many things the URA has to deal with. If this is undertaken by the Architectural Services Department, there is a cost incurred as well on, for example, manpower. So we think that this fee charged by the URA is reasonable, but we have heard Mr. Chan's views. We will provide supplementary information after the meeting. I think there is little room for us to further compress the cost to lower than $2 billion, but we will review this. Mr. Michael Luke. Thank you, Chairman. This project is to build a joint user complex in Sham, Shui. I think there's a need to have this building, but I am concerned about the cost. Mr. Chen mentioned about the entrustment fee for the URA. We look forward to hearing from the administration at the Finance Committee to see whether there's room to further compress the construction cost. If this is dealt with by the contractor or the government, what would be the difference in terms of the cost? We want to have this information. Now I'm looking at the other joint user complex projects undertaken by the government recently. I remember that there is the project 69RG, the joint user complex in Area 108 in Ma On Shan. It is slightly bigger than Sham Shui Po. It also cost about $2.8 billion approximately. The construction cost, the unit cost is $30,000 per square meter. It's cheaper than the $33,900 per square feet. In this project, it is cheaper by about 10%. For that project, there is a library as well as an indoor swimming pool. We want to further enhance the cost effectiveness of this project. I know that this is not an apple-to-apple comparison because the two projects are different, but there are similarities between the two. Now, another question about the technical details. There will be social welfare facilities, district health centers, as well as a sports center in this joint user complex. So we are looking at 3 different types of potential users. One, the underprivileged who need the facilities. Another, those who like to do sports, they might be children. And third, we have patients using this complex. Is this complex going to be able to cope with such a high footfall? Will there be lifts to take care of these 3 types of users? The top levels will be for the sports facilities, and the middle floors will be for the district health center, and the lower floors will be for the social welfare facilities. What are the considerations behind such arrangement? Mr. Poon? I'll first answer the third question. This is a single-site, multiple-use development model. We have very tight supply of land in Hong Kong, so we are making use of this opportunity to adopt the single-site, multiple-use model and put different types of facilities in one single complex. You said that we will have 3 very different types of users. I agree. That's why we will have 3 sets of lifts that will serve different types of users. As mentioned, the opening hours as well as the use of the lifts will be different. Mr. Michael Luke is right. How come we are putting the facilities at different levels? For social welfare facilities, according to the law, they have to be placed above ground within a certain height. That's why they are on the lower floors. And for the middle floors as well as the top levels, there will be sports facilities. We believe users of these sports facilities will be able to walk freely without any problems. Another advantage of putting these facilities on the top levels is because we can have bigger headroom and we can have basketball courts on the top levels. Now, on the comparison of construction costs, I will defer to the Architectural Services Department. Mr. Matthew Ute, member mentioned about Area 103 project in Ma On Shan. It involves a large-scale car park, and in that particular project, 354 parking spaces are provided. So there is a large floor space for a car park in that project. And the unit cost of this kind of car park is relatively low. For the project in Area 103, how come the overall unit cost is lower? It's because it involves a large-scale car park. This joint user complex in Sham, Shui, 40% of the space will be for healthcare facilities, and the unit cost for this kind of facilities is relatively higher. That's why we are not comparing this project with the one in Area 103 in Ma On Shan. We'll extend this meeting by 15 minutes. Now I'll invite Mr. Chu Pok Keung to speak. Thank you, Chairman. I support this project. I want to express one point. The idea of the single-site multiple-use model is great, but I think the government should take care of the needs of people. This joint user complex will see a greater demand compared to other facilities. Well, this building will be built in the railway protection area, and so there can't be another level of car park. Well, this is not desirable, and if people aren't happy with this building, it will give people the impression that it is a waste of public money. Mr. Poon? We faced challenges when we identified the site. This location is well served by public transportation. You can go there easily from Lai Chi Kok Station and Cheung Sha Station. There are also lots of bus services nearby. You get off on Cheung Sha Road and you can easily walk to this building in future. We have to take into consideration the condition of the site. We also consider whether we can provide convenience to members of the public. And we have to strike a balance.
Mr. Lemon Kwong speaking for the second time. I will then put the item to vote. 3 minutes, please. I'd like to reiterate that I do not oppose to providing support to singletons who are in need. However, when it comes to hostels for single persons, I would like to make sure that resources are better used. That's why I oppose to the provision of hostel for singletons at this project. I get the feeling that there is a silo mentality hearing from different departments. They don't even know what the available service capacity is at a Sunrise House. It seems that it doesn't really matter if there is any spare capacity elsewhere. I just want to put this facility here. I think a better approach is to consolidate existing resources. Put the same resources at Sunrise House because they are of the same nature. If you just move the facilities there, then support can be swiftly provided for those who are above the age of 60. They don't have to wait for 4 years. So there is indeed room for improvement in this regard. I expect better use of resources. There are competing needs from those suffering from mental disability, physical disability. There are people who are accommodated at inadequate facilities, sheltered workshops, who suffer from water leakage. The facilities can be better provided elsewhere. I just want to say that there can be better communications among different departments. Resources can be used better. So I would ask for further discussion at the Finance Committee meeting. In relation to better communications among different departments, I heard the member loud and clear. I will ask the Home Affairs Department to follow up. The hostel for singletons will be put on the 6th floor of the complex. It's only half of the floor. The other half is the Lai Chi Kok Social Welfare Office. We want to maximize floor area to provide as much social and welfare services as possible. If there are no other members, I will put this item to the vote. Those who are in favor of PWSC 2526 number 14, please raise their hands. Those against, please raise their hands. None. The item is passed, endorsed. Now, in relation to further discussion by the FC, I will now put this question to the vote. If the question is passed, that means there will be further discussion at the Finance Committee. If the question is negative, there won't be any further discussion by the Finance Committee. Those who are in favor of a further discussion of this item, please raise their hands. Those against, please raise their hands. 1. That means there will be further discussion of this item at the Finance Committee. That is the end of this item. Thank you for attending.